Right, well, welcome everyone. I am excited about this meeting. I've known Michelle for, I don't know, how long have I known you? Probably 10 years, I
At
suppose.
least. Probably
Yeah,
a bit longer than that, actually, because I've been married for 12, so maybe 14 years. I'm not sure.
wow, time
Quite a
flies.
while.
That's
It does.
amazing. Okay, well, I thank everyone who is here, and I would like to start with a prayer before we
Before we
have this meeting. And just remember to mute yourself when you come in, and let's have a quick prayer and we'll get started. Heavenly Father, thank you again for this opportunity to meet together. I thank you for the technology that we can do this. And I pray that you would give us clarity of mind and help us to remember everything that we need to share. Be with Michelle and guide her mind. In Jesus' name, amen. Okay. Well, again, this is my friend Michelle Bennett. She sounds like a Brit to me, but she's living in England as an American. I guess everybody that is a Brit in England went by way of Nebraska, right? Yeah, originally from
Exactly.
Nebraska. Okay, Michelle, why don't
Exactly.
you tell us a little bit about yourself?
Yes. So, as Dana kindly said, I am an American. I've been living in the United Kingdom for 12 years now. A little bit of my background as far as what I do professionally and how I got into ozone. So, my background professionally is in medicine, specifically ophthalmology. In the States, I worked as an ophthalmic technician for 7 years before I moved to the UK. I was working in the clinic there. We saw anything eye related, and so it's kind of a nursing background. When I moved to the UK 12 years ago, I couldn't go directly back into that without going to school. So I have since been working in the commercial side of ophthalmology, basically as a manager for a range of medical devices used in eye surgeries. When I first moved to the UK, I developed some quite serious, severe allergies because obviously the UK is known for getting lots of rain. So the houses are all made out of brick and there's not very good ventilation. And so, as you can imagine, the combination of all of those things leads to a lot of mold and a lot of mold spores that are in the air. I was very unwell from the first time I moved to the UK. Very quickly, I started to have a lot of allergy type symptoms. And I started looking for a way to help myself. Obviously, I've always been, my family has always been very interested in alternative medicines from my childhood. So I was looking for ways to help. Obviously, the antihistamines weren't an option for me. So I was looking for whatever I could find that would help the situation. And in that search, I came across ozone. So from the very, this is going back 12 years. I think my dad actually might have been a little bit interested in ozone prior to that, but we didn't know a huge amount. And that's the beginning of my ozone journey. Let's call it that way. I, I did purchase a home air purifier, an ozone generator, which I can show you in a little bit. It's quite different to the medical side of ozone, but it is at the beginning of my journey, so I thought I would mention it.
Okay.
And I got amazing results. From that point on, it just using it to kill all of the mold in my home and any kind of odors and things. It worked amazingly well, and so I continued using that, and I've had huge success with all sorts of kinds of things. I can now have a pet. We have a dog. His name is Maverick, which I'm happy to say I'm no longer allergic to him anymore or any kind of pets or animal dander. And that's purely down to ozone. That has progressed. My interest in ozone has grown, and I continued studying and looking and doing the research to figure out what else can I do with this amazing gas, if you want to call it that. And that is how I progressed into probably, let's see, 6 years ago. I started looking into medical ozone. And that's shortly after that, I bought all of my equipment and I started experimenting. There wasn't a lot of information out there for someone like myself. There was just little bits and pieces. And so I experimented. I was my own guinea pig. I just started testing things on myself, possibly family and friends. And from there, I've now grown to the clinic that actually I run out of my home now.
Okay, that's interesting. I am my first guinea pig, and Kalen is my second. He's a
Very
good
good.
sport. He lets me practice on him. I find it very interesting that I know that the home ozone generators that are used like for air purification are very good for mold. But I find it also interesting that ozone therapy is good for those who've experienced a mold toxicity, and we'll talk more about specific applications for ozone in just a minute. But before we get into that, there may be some people on here who really don't know what ozone is. Can you kind of fill us in a little bit? What actually is ozone and what does it do in our bodies? How does it react and what is it that it's doing? Because I have heard that ozone is a pro-oxidant. And so let's sift that out a little bit.
Sure. So ozone is, now I'm not going to go into really depth of the whole
That's
chemical
fine.
makeup,
That's fine.
because probably I wouldn't be able to explain it very well anyway. But ozone is found naturally in our environment, and that's why I was attracted to it, because I'm attracted to anything that is already there, that is God designed, and ways of utilizing that. So, ozone in our environment is basically made in two different ways. Basically, the rays of the sun, when they come down into our atmosphere and they come in contact with the oxygen at a certain wavelength, that is when ozone is produced. And so, obviously, we've all heard of the ozone layer that
Right.
surrounds the world. So, that is one way that ozone is produced in our atmosphere. A second way that ozone is produced in our atmosphere is during a thunderstorm, when a lightning bolt strikes and it hits the oxygen molecules, it actually breaks them up and then they clump back together. But there's three of them that are clumping back together. And that's where we get the ozone atom, the ozone gas. And so that's why the smell of ozone, when I'm doing treatments for people for the first time, they will say, "Oh, I've smelled that before." Well, yes, of course, you have smelled that before because it is a natural gas. It is produced in, and most people can't really tie it to when they've smelled it before. And so I remind them, was it during a thunderstorm or directly after a thunderstorm? And yeah, it actually was during that time. And that's when it was created. Now, the home ozone generators are actually using, and even the medical generators are using that technology. Basically, the technology is mimicked of what the lightning bolt does to the oxygen in creating the ozone. I call ozone therapy as an oxygen therapy. It's like a supercharged oxygen therapy that we're basically utilizing to help people with various conditions that they might have. Basically, our bodies work on oxygen. We need oxygen to live. If we don't have oxygen, then we die very quickly. And if we are in an oxygen rich environment, we know that our earth, our world before the flood, I'm a Christian, so I believe that our world before the flood was a very different place. The oxygen was richer because the world was enveloped in water. And so our oxygen was completely different to what it is now. And it's similar to what people might experience in a hypobaric chamber. So plants lived better, we were taller, everything was in a better situation. So when we incorporate oxygen therapy or ozone therapy into a healthy lifestyle, it promotes healing because simply from the basis that it's helping oxygenate the cells of our body.
Very interesting. You know, I've listened to a lot of lectures and stuff, and I was listening to I can't remember the guy's name now. He's brilliant. Uh, Zach Bush, I think, is who I was listening to, and he was talking about cancerous tumors and how they basically are sealed off from good oxygen flow and really from the rest of the body. They don't have, you know, they do have circulation, but they're essentially isolated. It's these cells are just in isolation, and they they can't survive if you put more oxygen in there. And so I'd like to ask a question, and you can answer that, and then I'd like you to go ahead and share a story, a testimony of an experience that you just had, since we're talking about cancer just a little bit here. But it sounds to me as though ozone is safe for everybody. Is that safe to say?
So ozone is I from my experience, and I've treated a significant number of people. I've never had a bad reaction to it. There has been some reports that I've studied that they say that if you have an underactive thyroid, that there's supposed to be a counterindication there. I have treated people with an underactive thyroid, and we haven't had any reactions to that. But I do have to put that disclaimer out there because it is a known thing. Ozone in high concentrations can irritate the lungs. So I wouldn't encourage anybody to just go out and start breathing a lot of ozone because you will have problems associated with that. And also at very high levels of ozone, you can also experience some detoxing reactions. But for the most part, I would say that ozone is actually a very, very safe treatment method and a very useful tool that any health practitioner or any even home user, if you get the right equipment, you can use to really boost your immune system, boost your overall health. But as you rightly mentioned, Dana, we know, and it's widely recognized that cancer can't survive in the presence of oxygen. So the use of a supercharged oxygen, like ozone, as an example, should prove to be very beneficial in some of those situations.
Okay. You mentioned, and I just want to touch on this because I have heard and read in my research that if you get too much ozone and you're having this Herxheimer reaction, you know, this detox type reaction, that the counter for that is some vitamin C. You know, vitamin C is a very powerful antioxidant. So have you had to do that, or have you had any experience with that?
So I have actually, as of recently. So I've read that from all along. I also use what's called a liposomal vitamin C with a lot of my treatment plans. So I always have some in my home. I've read that since the very beginning of my studies, that basically if you add a very high dose of an antioxidant, obviously ozone is an oxidant, if you add it together, they cancel each other out.
Right.
Now, as I said previously, I'm my first guinea pig, and so there has been situations, especially when I did some work with dental things, where I breathed in a huge amount of ozone. And boy, let me tell you, you don't do that twice. You cough a significant amount and it's not very comfortable. At that point, I did think about taking some liposomal vitamin C, but I thought, well, I didn't want to cancel out the effects of the ozone. So I never did it to myself up until probably just what was it 2 weeks ago. I had a little girl that came with her father that wanted some dental work done, and she was feeling a little bit maybe neglected, so she said that she had a tooth that was bothering her and she wanted me to give her some ozone treatment on her tooth. And her mother agreed. She's only 8 years old. She did have a little cavity and she was having some pain. So I said to her, I said, look, you can't breathe the ozone. Now, an 8-year-old child, obviously things get a little bit complicated. I had the fan blowing on her, and she said she promised she wasn't going to breathe any of it in, and she was just going to breathe through her nose. But she did get some in her lungs, and so then she was coughing. So then at that point, I thought, okay, we're going to test this theory of the antioxidant with the oxygen and see how quickly it works. Now, she was coughing quite significantly. I gave her 1,000 milligrams of liposomal vitamin C, and within 15 minutes, the cough completely went away. So I attribute that directly to the vitamin C, because when I've ingested that much ozone, I was coughing for a good probably 6 to 8 hours. So 10-15 minutes, you can see the effect that it actually canceled it out very quickly.
Wonderful. Good.
And
Okay.
so I keep it in my clinic and ready just in case anybody has any problems.
Good. I have a video on how to make liposomal vitamin C. If anybody's interested in that, our YouTube channel is under my name, Dana Gazelshian. So it's, and I think the first time I ever made liposomal vitamin C, your sister had recommended a book for me, and I got the book and started making it.
Very good.
Yeah, I just wanted to let people know we are going to talk about actually how to administer ozone here in just a minute. Michelle's going to take us into her clinic and show us her setup and actually how to do it, and you'll understand more about some of the things that we're talking about in a little bit. But I'd just like to address briefly this. You mentioned, we were talking about the antioxidant effect of vitamin C and the pro-oxidant effect of ozone. Ozone is a pro-oxidant, but is that dangerous to us? Does that harm us in any way?
No, definitely not. If anything, it's the exact opposite to that. The oxygen, when you have that oxygen enriched environment and you put it into the places where it is needed, it promotes healing. It promotes regeneration of the cells. Now, I am a firm believer in liposomal vitamin C, and I would encourage anybody watching this video to look at that, because I think that vitamin C is another tool that we should have in our toolbox for helping people. It just works in a very different way. And if you're using, obviously, if you're using ozone, you need to separate it out, because they're going to cancel each other out. Use ozone and then wait 2 hours to have any kind of vitamin C. If you take vitamin C, wait 8 hours before you have ozone therapy.
Perfect. Thank you for bringing that out. I appreciate it. That was one question I was going to ask. What type of time should you have? Okay. We mentioned the patient that you had that had cancer, and I'd like you to just take a little bit of time and give that testimonial right now, so that people could kind of have an idea of what can be done with ozone therapy.
Sure. So before I get into that, I just feel like I need to say that ozone is a tool. Like I said, it needs to be combined with a lot of other things to have the full effect. I'm not a doctor. I don't diagnose and prescribe medicine. So in this video, I will discuss a lot of the experiences that I've had and what I know about ozone. But that doesn't replace, obviously, medical attention when you need it. Let's put it that way. So the situation, probably, I mean, I've seen cancer patients before, and I've had quite a significant amount of success with cancer patients previously. But this was the most severe. Basically, a friend of mine referred her dear friend to me for ozone therapy. And she came from Italy. Now, this couple, it was a husband and wife. They live just outside of Rome. And early on in life, they've never left their home in Italy. She was scared of flying, And so she vowed, she saw something traumatic when she was younger, and she vowed that she was never going to fly. And obviously, my friend told her to come because she had quite serious diagnosis of cancer. She had a complex history, but basically, the most recent diagnosis was that she had a 13 centimeter tumor in her rectum. And there was an associated involvement with the lymph nodes in that area as well. The cancer had spread to the lymph nodes in the area. Um, she prayed about it. She's a Christian. They're devout Christians. They prayed about it and they felt impressed to come. So her and her husband, shortly after that, well, let's go back a little bit. So she had one round of radiation, which damaged her quite significantly. She was in a lot of pain and misery because of the radiation therapy. The option that they gave her at that point, because it didn't do anything to the tumor, the option that the hospital gave her at that point was they couldn't cure it. It was too big for operating to remove. The only option that they had for her at this point was to do very aggressive radiation with the potential outcome that they could prevent it from getting worse. But the consequence of that was that she would be completely incontinent. So then at that point, she decided, before she even knew anything about me, that she would rather die than put her family through that, be put through that humiliation of being incontinent. So she was essentially just giving up. And then that's when she came to me. Now she was very unwell. She came, and her husband sat in my living room. I don't speak Italian and they don't speak English. So it was an interesting conversation. But it was communicated to me at that point that the husband did not believe that there was anything I was going to do that was going to help her. So I said a quick prayer, trying that God would give me the words that would give them a bit of assurance. But both of them agreed that for circumstances outside of my knowledge, but that God had sent them to come for ozone treatment and to come to me specifically. So we started the treatment. I completely. She had a lot of other complications. Like I said, she has diverticulitis. She had severe hemorrhoids after the radiation that she had. Previously, she had a gallbladder removed. She had a previous history of cancer. She had cervical cancer quite a good number of years ago as well. So she was very unwell. She had lost a lot of weight because of the radiation, and she was needing to go to toilet 20 to 30 times a day. She was spending most of her time in the toilet, a very painful situation. She couldn't sit for any length of time, and when she did sit down, she had to sit on one of those cushions because it was very painful for her. She was passing a lot of blood, and she was on significant amounts of pain medications. So I don't know, Dana, if you want me to go into the actual treatments, or basically the outcome of the treatment.
Maybe we can just briefly tell what you did, and then we're going to introduce to the people actually how different ways, because there's more ways than what you did with this lady to administer ozone. We'll flesh that out a little bit just to let people know. But go ahead and just give us a little thumbnail of what you did for her.
Okay. So to begin with, like I've said before, ozone is just a tool, and it needs to be combined with a lot of lifestyle changes and things. Right. So I completely changed her diet. I put her on a fast for it's actually an enzyme fast that I put her on to try to rebuild her digestion. A lot of people I try to put on a juice fast, but I knew that with her compromised digestive tract, the diverticulitis, the diet that she had been on previously, she would need to rebuild something. She wouldn't be able to absorb anything. So we combined a complete change of her lifestyle, and praise God, she was open to everything, and she made all of the necessary changes that she needed to make. With ozone therapy specifically, obviously with rectal cancer, the cancer was easy for me to access simply by administering the ozone into the rectum via a small catheter. We started out, it was very painful for her, obviously because of the hemorrhoid situation. So we had to start out very low. We combined, I was giving her a significant amount of ozone because I knew that my time with her was going to be limited. And so I made sure that she had some ozone every day. We combined the rectal administration also with either the ozone sauna. We also did vaginal insufflations, um, and probably breathing as well. We did some breathing at the beginning as well, but she was getting small doses of ozone every day, for a significant amount of time, in addition to all of the other things. Liposomal vitamin C was a big part of her treatment as well. But with ozone, I really feel like the lower dose over an extended period of time has been the most beneficial, for the people that are unwell, as compared to doing a short session with very high ozone. She, I mean, she tolerated the ozone quite well. Um, and we just, like I said, I started out a very low gamma and then kept increasing as her tolerance would permit.
Okay, you introduced two things there that I want to let people know that we are going to talk about, and that's what we're moving into here in just a minute. You use the word gamma, which that is the measurement of ozone, which we're gonna talk about that. And somebody asked about what is a vaginal insufflation. We're going to cover that, so just stay with us. And but what I would like for you to just move forward, tell me what the outcome was with this dear lady.
So she was here, she was with me for 2.5 months. And again, we changed the program. We did a lot of ozone for her in combination with a lot of different things. On the 19th of June, she went back to Rome at the beginning of June, and she had her MRI scan in the biggest university hospital in Rome. And as you can imagine, I'm anxiously waiting for the results. The results came about 2 weeks after that. And all I can say was, all of us were praising God at that point, because the tumor had shrunk from the 13 centimeters to 4 millimeters.
Praise the Lord.
And the associated lymph nodes, all of those were clear. So she's now left with a 4 millimeter tumor that she will continue to administer ozone at home. And
Praise the Lord.
she's off of all pharmaceutical medications. She was able to drive again, which she hadn't done in a very long time. She's eating the fruits and vegetables normally, like she hadn't done. And the joy that's in that household and the joy in the family is just incredible experience for me.
Amen. That's such an amazing thing to be a part of, whenever the Lord blesses what you do. And I really like that you emphasize that it's not just one thing. We have to address the diet, we have to address the lifestyle. God doesn't want healthy sinners. He wants us to be obedient with there are laws of health. He created us, to subsist on a certain dietary, and when we cooperate with God, He can bless our efforts, and it's so amazing to see that. Michelle, what I'd like to do now, if you don't mind, I'm gonna just put the spotlight on you, and I would like for you to take us into your treatment room. Show us the setup, and then I'll just kind of be in the background and ask some questions.
Okay.
But there's several things that I would like for you to talk about. So maybe you can start moving to your treatment room,
Okay.
and we can answer a couple of these questions before before we get going, you mentioned vaginal insufflation, you mentioned breathing ozone. Now, you mentioned also with this young lady that the little 8-year-old, she breathed ozone and coughed and coughed and coughed. So there's a way that you can modify the ozone so that you actually can breathe it through a nasal cannula. Can you address that? And what's the difference between, just breathing ozone gas in the air from doing another treatment versus a safe way to inhale the ozone gas?
Sure, of course, of course. So I will turn my camera around to show you my treatment rooms. Apologies for the sun that's shining in through the window. So this is my examination chair. You have an IV pole there. And I'll talk you through the equipment as I go through. This is my ozone sauna. So it's a steam sauna that is also used with ozone. And then I have one of my ozone generators over in the corner there, along with an oxygen tank. The little blue machine here is an oxygen concentrator, which can also be used to create the ozone gas basically through the generator over there. So as far as the different ways of administering ozone can be safely taken into the lungs, obviously through the sinuses, if the ozone is bubbled through oil. It changes the gas enough to be able to be tolerated by the lungs. And so what we're looking at here is it's an ozone oil bubbler. So basically what happens is the ozone gas goes into here through a tube, and then you can use various methods of treatment through the ozone after it's been through the oil will be then administered through here. Normally for this treatment, I will do just a normal nasal cannula, and people will just kind of sit on the chair and breathe it in for a good, whatever the case may be, maybe 15, 20 minutes, depending on the situation, depending on what we're treating. I guess I will go through basically the ozone and the gamma that we discussed before. Now on the ozone generator here, I will turn this back around so you can see the generator. It has a chart that talks about the gamma and the settings. And so basically it's just the strength of the ozone. And so this is where I use all of the generators from PromoLife will come with this chart, but you can also get the chart depending on the manufacturers that you use, where you buy your machine. They should provide you with a chart depending on that specific machine. So basically what happens is this is purified concentrated oxygen that is going from the oxygen tank and being put into the ozone generator. As I discussed initially, basically all it's doing is very similar to the lightning bolt. It's converting the oxygen into an ozone gas. And then from the generator, it goes out the ozone out pipe. And then that ozone out pipe can be then either put into the oil, or for most other kind of treatments options, I bubble it through water because it gives it a little bit extra moisture, because ozone can be a bit drying. And so that's essentially the setup. You take it from the ozone generator, and then the gas is just flowing to whatever kind of method you're going to use for administering the gas to the various different parts of the body, depending on the need and the problem that you're trying to resolve.
Okay, so on that chart on top of your machine, that actually is how you calculate the gamma, at whatever rate your ozone is flowing, plus whatever strength you have your machine set on for the ozone, and that produces your gamma, which is the measurement of strength of your ozone. Is that correct?
Yes, that is correct.
Okay. Now, one thing I would like you to touch on is the equipment that you use. ozone is a little bit destructive to like plastics and things like that. So you have what kind of tubing attached to your machine and stuff? What kind of tubing is that?
So it's all silicon tubing. Even the silicon will degenerate over time. So you have to keep an eye on it. Make sure all of the tubing is in good repair, good shape. But the silicon seems to last the longest. I actually prefer the silicon because you can get some various different types of catheters for, as I mentioned before, the either the rectal or the vaginal insufflations. I prefer the silicon ones. I like silicon because our bodies tend to accept it okay. There's silicon implants that are used in the body that have been used in the body for a long time. Obviously, we're not implanting anything with ozone therapy, so it's not such an issue. But there is a very low rate of any kind of allergy. So I do really like the silicon, and I encourage people to use silicon where possible because I know that it's not going to degenerate with the use of the ozone.
Okay, let's list off the ways that ozone can be administered at home.
Okay, so as I mentioned before, you have a normal, just a nasal catheter here. And basically, you just use it normally, just breathing
Hmm.
it in.
And that's
We
bubbled
have,
through the oil.
yes,
Okay,
definitely.
okay,
That
good.
that's bubbled through the oil. We have
Is there any special kind of oil that you have to use for that, or can you just use olive oil? Or
So I use olive oil. From my research, it depends. It depends on what you want to do with it afterwards, because obviously after you've been using it for a period of time, it will become so saturated with ozone that you will no longer be able to use it for the purpose of bubbling through to make it safe to breathe.
hmm.
And so, but you don't just want to throw it away because actually ozonated oil has many different purposes in itself that we can discuss possibly as well. So that might make an impact on what initial oil that you use at the beginning if you want to use it as a byproduct later. I personally just use normal olive oil, not extra virgin olive oil. I just use a standard olive oil.
Okay.
And I think that that's actually been recommended by a good number of different places as being one of the best. It lasts the longest, so it doesn't get saturated with the ozone as fast as maybe some of the other ones. And so that's what I use, and that's what's in my bottle now.
Perfect.
Um,
Okay. What
so
might you use the ozonated oil for?
so you can use it for a whole variety of different skin situations that you have. I personally like it as a deodorant. It
Interesting.
won't prevent you from sweating, and if you can tolerate the oil, because obviously it's an oil, but it completely eliminates all of this smell and it keeps you smelling fresh for a good long time. From personal experience,
Okay.
you just have to be a little bit careful because it is an oil and it can get on your
Stain.
clothes and it's hard
Right.
to get out. So
So
the
the ozone will stay in the oil, but it will not stay in water. Ozone actually will evaporate over a couple hours. Is that correct from water?
Yes, that is correct. Actually, it's 50% less potent after even 30 minutes, depending on the temperature.
Okay.
The colder the temperature, the longer it will stay in the water. But that's exactly correct. It won't be retained. You can't store ozone water and think that it's going to be effective if you drink it the next day. By 2 hours, it's completely eliminated of ozone.
Okay, we are going to take a little bit of time at the end for questions, but somebody asked a really good question in that in regard to the ozonated oil. How can you tell when that oil is so saturated that you just can't use it anymore for breathing it in?
So it actually, I'll show you my bottle here. As you can see, this is normal oil.
Right.
It's yellow. It looks like oil, it's moving like oil. When it gets saturated, it actually changes color. It becomes kind of like a white color, and it also becomes very, very thick.
Okay.
And it's almost like when I put it in the fridge because actually it's been said that ozone will stay in the oil for up to 10 years if you keep it in the fridge. And
Wow.
so it'll keep for a very long time.
Perfect.
And so I put it in little pots. I give it to people that come for various, even eczema situations or rash situations or bug bites. The uses for ozone oil is limitless. You can put it on a lot of different things, inflammatory responses, even like pain. You can massage it into areas of pain, and it will reduce the inflammation and help with some of the pain associated with inflammatory conditions.
Perfect. Okay, let's go on.
Okay, so we covered the breathing side of things. Now it's maybe some of the more invasive that people don't really like to think about or potentially talk about is rectal and vaginal insufflations. It's basically exactly how it sounds. You're injecting ozone into the various crevices of our bodies. And I use, like I said, I like silicone. This is a silicone catheter that is from Promolife, and it can be reused. Wash it, reuse it. So this is inserted into either vaginally or rectally, and then you inject the ozone gas into those areas. And again, the strength and duration is dependent on the conditions and also the tolerance of the patient. So that's the two methods with the silicone catheter. I don't know, Dana, how in depth you want to go with that side of things.
Yeah.
I think that's
Well, one thing I'll say is if you're going to do rectal insufflations, be sure and lube that thing first.
yes, and to be honest, I would not do a rectal insufflation, and I would not administer a rectal insufflation on anybody who hasn't previously done an enema. I think that it is essential that you clean out the colon to get the maximum benefits, because obviously the ozone will be used by whatever is the closest to where you're putting the gas. And so if your colon is full of feces, it's going to be used up on waste matter that's going to be go out anyway. So it's not going to be as effective for you. So you must do an enema before you have a rectal insufflations. And you have to be a bit more cautious with rectal insufflations because obviously there is a bit of discomfort associated after something like that. You do feel a bit of fullness and like you have gas that normally goes away within a few hours. But it
Okay.
is a good systemic way of getting ozone into your body because it's been shown to take it into the blood via the liver. And so it's not just targeting the colon and rectal areas, but it's taking it systemically all throughout the body.
Now you start talking about the liver, you get me fired up. That's
Right.
my hobby horse right there. I have actually read that ozone can increase bioflow, and I preach bioflow and liver detox and all these things. So I'm pretty excited to do some research on that. Now, just a quick question here. Somebody is asking, can you use a urinary catheter to administer ozone?
Yes, you can. I will be perfectly honest with you. I recently have been contacted by a person who has prostate cancer, and I do have some catheters. They're much smaller than this.
Yes, obviously, yes.
um, I'm not sure how, because obviously when you go into that direction, it is more invasive and it's going to cause more discomfort than a rectal and a vaginal insufflations. I would feel comfortable doing it. And it has been shown to be very beneficial for maybe a bladder infection or, like I said, the prostate cancer. But it is, like I said, it is an area that is going to be more difficult to administer to, and it's going to be more uncomfortable. So I tend toward the things that are less uncomfortable for the
Very,
patients, and
very
and
good.
hope for the good result.
Okay. All right, move ahead. When would I do a rectal as opposed as a woman to a vaginal insufflation? Because you can obviously use this vaginally as well.
Sure. So both methods actually take the ozone systemically. We talked about it going through the liver and into the blood. So us women have a benefit of a secondary option of administration to ozone, which is very, very good. And the theory there is that actually when you administer ozone vaginally, it takes it systemically through the lymphatic system. So you're getting a full body systemic effect from the ozone and treatment from the ozone. It's just going the way of the vaginally. I've had a lot of patients that have had very good results, some with lymphomas, which is what I would use as the treatment of choice for a woman with lymphoma. She would have significant treatments of vaginal insufflations, but any kind of vaginal related issues, I've had great results. Painful cysts and things will go away. It will correct hormonal imbalances that, I mean, in myself, it corrected a lot of painful cycling and things associated with that. So I think that there's a lot of things that obviously ozone will can be used vaginal insufflations. I think that it's a treatment of choice for a lot of different things for me, for patients as well.
Perfect. Okay, how else can I take ozone
So,
into my body?
um, I probably one of the most impressive, quickest things that I've used ozone for is dental work. You can use this here, and again, this is just the same tubing. The ozone gas gets attached to this handpiece, and then you can place that little cup over the tooth. It only takes 3 or 4 minutes, and it can eliminate basically a toothache, any kind of infection. The pain just goes away, and that's been very impressive to me. I have a lot of people that have experienced that. Either they've had an area where they had a tooth removed and it got infected. Just after a few treatments, it took the infection away. And also just some infected teeth. I'm currently treating a few people with periodontal disease, in which case I have.
While you're getting that, I just want to interject. I was listening to a lecture on an oral health summit just yesterday, or actually, I think it was Sunday, and they made the statement that 80% of all diseases have a connection to your oral health. So if you have
Yes.
issues of infection or cavitation, if you don't know what these things are, maybe we can cover them in a future video. But many people have these silent infections in their mouth that they don't even know are there. They don't have pain, they don't have any symptoms, but they're causing things like heart attacks. I mean, it's crazy the connection between your oral health and your overall physical health. I mean, we're very much connected.
Definitely, definitely. I agree with that. That's something, especially when people are dealing with chronic illnesses, that really does need to be addressed.
Yeah,
Um,
it's something that I addressed. I have autoimmune disease and Rocky Mountain spotted fever, and I went to a biological dentist, and he found stuff I didn't have any idea was going on in my mouth. I had to have a cavitation surgically repaired, and I really feel like that once I had that repaired, it sort of cut one of the strings that was kind of holding me down from
in your
my
back.
recovery. Yeah. So
Sure.
that's one of the things that I address with everybody now when they come to me for counseling is for health counseling is, you know, what's going on in your mouth. So go ahead.
Exactly, definitely. So I'm not seeing it here for some reason. Basically, PromoLife also do it looks like a silicone tooth guard, and it has a whole bunch of holes in it. You put it in your mouth and just let it treat your whole tooth line. top
Interesting.
and bottom. And it unfortunately a lot of times it's out of stock, and it's out of stock at the moment. So don't rush out and try to buy one because it's out of stock.
Okay.
But it is amazing. Keep an eye on it. I think that it says that they're going to be back in stock in the middle of August or something like that.
Hey, what about the
Um,
ozone water, that you bubble the gas through? Can you swish and swallow with that? Can you drink that?
Of course, definitely. I use that quite a bit. Swish and swallow. What I like even more than that is if you get a water flosser
Perfect.
and put the ozone water in there and give your mouth a nice water floss, but also the ozone is going to kill a lot of the bacteria and anything that's in your mouth. This is an amazing tool. I use it all the time and I recommend it to a lot of the people that come as well. So
Perfect.
dentally, it does work very, very well. But even swooshing it in your mouth, as you said, drinking it, that is another huge thing. I had someone come to me with severe gastritis. Every time she would eat, she would vomit because of this inflammation that was in her gut. After one glass of ozonated water, she went home. She had dinner. She said that she felt hungry in the first time in a year and a half, and she didn't throw up afterwards. And so
Wow.
that just kind of demonstrates how powerful ozone can be for a lot of these different illnesses.
Yes, I've experienced that. I have some GI issues secondary to the autoimmunity and stuff, and it definitely when I've done both rectal and vaginal insufflations as well as drinking the ozonated water, and I do nasal ozone too, where I just pull it up in a syringe and I plug one side and take a deep breath and inject it, and then I plug my nose, and from my mold toxicity, that really has helped to clear out my sinuses so that I can breathe better. But I really
Very
have
good.
noticed a significant improvement. While I'm on that, um, and I know I want you. Well, let me just let you finish talking about the ways of administration, and then I
The
have a very
different, okay.
specific question that I want to ask
Sure,
you. So
sure,
go
of
ahead.
course. So I did find this. This is somebody asked about inserting it bladder for like a UTI or something. This is the catheter for that. It's very small. It's much smaller
Perfect.
than, where's my other one? So you
The
can kind of see
rectal,
the
yeah,
difference in
big
that.
difference.
Yes. Yes. So there, that is an option. It's much
Okay.
smaller, but like I said, it's still kind of uncomfortable. Other methods, I have this device here. This is called cupping. So let's say you have maybe a skin infection or a bug bite or even a small tumor. Basically, this can be placed over the area. And then again, the ozone gas will go directly into here and onto the area that's been affected. Now, the top bit, you might be wondering what this top bit is. This is
It's a
activated
destruct.
charcoal. It's
Yes.
the destruct. So, as I mentioned previously, ozone is not safe for us to breathe. So, this is a safety. The ozone will basically come up into here because it gets full after you're holding it on there for some time. And then it evacuates out of here. But the air that's coming out of here is completely safe because it's gone through the activated charcoal.
Okay.
We have a larger one that we can connect if needed to, like the water bubbler. If you're just wanting to make ozonated water, connect this to the tube so that way the air that's coming out is then filtered and safe to go into the air. Um, Other forms of administering ozone that I regularly use. This I use for ear insufflations. And basically, you just stick them in the ears. Again, the ozone is gone through here. Now, most of the time, ears are very sensitive, and I can't stress the caution enough. Obviously, I've known quite a good number of people that have gone a little bit too far with ozone into the ears. I started a very, very low gamma, and even a lot of times I will bubble it through the oil just to give it an extra layer of protection. Um, some people tolerate it very well, some people don't. So, whenever you start with ozone, I suggest and strongly recommend that you start very low and then
Right.
build up the tolerance. But that's a method of administration is the ears.
I noticed with the ear insufflation that sometimes it feels very warm when it
Mm,
goes in. It feels very warm. Somebody asked just real quickly before you go on,
yep.
how far when you're doing rectal or vaginal insufflation, how far do you insert that catheter?
I will just get it out to demonstrate. For vaginal, you insert it further than rectally. I would say probably a good maybe 4 inches.
Okay.
For rectally, maybe just an inch and a half. Here again, when you're going rectally, it's purely down to comfort. Generally speaking, unless I'm asked to insert the catheter, I encourage the people to insert it themselves because they can feel it and they know what's going on. I can't feel what's going on in your body. So
Right.
most of the time, people insert it into themselves, but that's generally what I recommend is an inch and a half, probably rectally, because that's going to pass the two sphincters and get it into the rectum. And then I have them laying on their right hand side, and that basically comfortably relax. The gas will just fill that area of the body. Same with vaginally. They're laying down. My chair reclines into a flatbed, and they just lay there for the duration of the treatments.
Okay, now if you were doing the for the urinary infection, how far would you insert that one?
Um, so that is still, like I said, I haven't done that yet.
Okay. Okay.
That is an area that I'm still studying and
Yeah, if you
trying to
insert
figure
it
out.
too far, you're going to get urine back, so you have to be careful.
Exactly, exactly. So you have to be very, very careful in that area, and that's why I've been a bit cautious to go down that road. Um,
Okay. Well, you're going to
so
get benefit from
yeah,
doing it other routes anyway, if you have that
yes,
situation. I would
exactly.
think drinking ozonated water, you're going to flush that through the kidneys and stuff, so that would help. So,
Definitely. And even vaginal insufflations is going to be in the general area, and ozone will absorb into the tissue that's surrounding wherever you're putting it into. So I
perfect.
haven't had a huge need or push to be able to really encourage me to go down that road yet. So I'm still in the learning phase of that area. I have everything to do it, but it's not something that I've done yet. And I'm still researching, and I want to make sure everything's safe before we progress in that way.
Okay, perfect. All right. Well, are there other ways?
The only other, so yes, so this is a face mask, and basically you just stick it over the face, and the ozone gas is piped into here. This is also bubbled through the oil because obviously you will be breathing this into your lungs, but it's very good for your skin. It's also, I use it for one of my patients happens to be also one of my customers, and they read somewhere that oxygen can destroy the meibomian glands, and so I was told that I could be destroying the meibomian glands of all of my patients by administering ozone treatments to them. For those of you who don't know what the meibomian glands are, probably most of you who have turned into this, the meibomian glands are the oil glands that are in the lower lids. You have some in the upper lids as well. And they are responsible for generating the oil film that goes over the eye that keeps the tears basically on the eye and moisturizes the eye. So, as you can imagine, if you destroy your meibomian glands, you're going to be in a very uncomfortable, unhealthy situation for your eyes. So I obviously, when I was told that I'm damaging my meibomian glands, this made me very interesting. For one, I didn't agree with it. I didn't think that was going to be the case. Two, I work in ophthalmology, so I have access to some diagnostic things, and so I had my meibomian glands tested. And actually, my meibomian glands are in a very good condition. My tear film is in a very good condition, and there's no signs of any atrophy to the glands, no signs of any problems associated with the ozone that I've been administering to myself. And obviously, I've had more ozone than all of the people that have ever come to me because I'm the guinea pig for myself.
Okay. All right. So, do you have any other tools up your sleeve for administration of ozone?
I have just one more. I mentioned about my IV pole that's in the corner. I have also, this is an ozone saline solution bubbler, and this can be used to administer ozonated saline solution directly into the vein via an IV drip. And this has been shown to be very good for various conditions, cancers and autoimmune conditions, all of those sorts of things. I think it's called the Russian method. If that is interesting to anybody, you could look it up. But that is the last option I think that I have. I think I've covered everything else. It's
Okay.
also a last resort. I don't resort to intravenous methods very quickly. Or like I said, it's a last resort. I don't really particularly like to do IV drips. Some people, I didn't mention that ozone can be directly injected. So I do have needles, and I do regularly just a normal syringe. I use this one because the stopper is very smooth. So you fill a syringe with ozone gas and you can inject it into various areas. I've found that this provides a lot of pain relief to conditions like rheumatoid arthritis, or just a lot of pain associated inflammation. You can inject it into the area. Obviously, when you're using needles and you're injecting into areas, proceed with caution. And that's not something I would recommend people are doing to themselves at home.
Okay. All right, great. So I think you covered that very well. I just have one very specific question that I wanted to come back around to. And particularly I want to do this because I have autoimmune disease. Can ozone therapy help someone recover from autoimmune disease? What would be the best method of administration for that?
So obviously there's various forms of autoimmune disease.
Correct.
I think that it is dependent on the condition that you have as to the way that you would administer it. I think that obviously, again, a whole body approach is going to be essential. Autoimmune is very complicated, and you have to look at various factors: diet, atmosphere,
Perfect.
mold is
Yeah.
an option. But as far as treating it with ozone, I do think that it can be a very beneficial tool. And I would do the systemic methods. Now, I would start with the rectal, vaginal insufflations, potentially the sauna. Sometimes, I mean, for a lot of my chronically ill people, I will do multiple treatments on one day. We will combine an insufflation, so either a vaginal rectal insufflation, we'll do one of those, and we will combine it with a sauna session, so like a 30-minute sauna session, and potentially even some injections or breathing, basically just flooding the body with a lot of ozone. Just to get it systemically. It's going to fight the inflammation. It also promotes, and I know that there's a little bit of controversy with regards to, does ozone kill gut bacteria?
Thank you. Yes.
So in my experience, I don't feel like it does. I almost feel like it encourages healthy growth of the good bacteria while killing the bad bacteria. Could
That's
it
what I've read.
and that's that. You can Google it, and you can find places where they say that it kills it. That hasn't been my experience, either in myself and in a lot of patients that I treat. It hasn't been what I've experienced. It's the opposite of what I've experienced. I think that you can safely use it. There again, if you go too far, you can get a reaction, but that's when you cut it back. You do it a bit more gently, and get to your tolerance level.
Okay. If somebody wanted to get into doing home ozone therapy, just doing some insufflations, breathing it, maybe drinking ozonated water, which are very good treatment options, what would be the cost? And I'm going to show my setup in a future video, what I have.
Sure.
But from what, just a basic setup, how much do you think that it would cost for somebody to get set up to do home ozone?
Um, so I have a dual machine, and possibly I'll bring it back in and show you. From Promo Life, you can get a single machine, and I would think for most home applications, unless you're going to do a sauna, most home applications can be done with a single machine. So when I say single, let me just turn this around. You have the ozone generator here. This is a dual. So we have Ozone 1 and Ozone 2. And so this is a dual machine. If you get a single machine, it's cheaper. I think it's only something like 700 pounds for a single machine. And by the time you get all of the accessories and things, you're looking at maybe $1,500. Probably you can get by less than that with various ways. It depends on how fancy you go with all of the consumables, all of the accessories and things that you go. Right. But I think for most people, it is accessible. It's within reach for a home user to have a generator that is going to provide the necessary strength to be able to treat actually most things. Promo Life do a more expensive version that I do have. It is, and I use this one it's the ARC that's ultra stable. I use this for the IV treatments that I do, simply because it is supposed to be a bit more predictable on the treatments that are given. Sometimes ozone can be a little bit unstable. But what I will caution people on is going out, because you can go on eBay, you can go on Amazon, and you can find something that's called an ozone generator.
Yes.
So I would caution people on that, simply because you can get something that generates ozone using metal as compared to, in my machine, it's ceramic. There's a machine called Longevity. I believe that uses glass. And those two are a bit safer inside the body. The last thing that you want to be doing is exposing yourself to heavy metals. We all know that heavy metals can be very, very damaging to us. So that's my caution, which is going out and buying a very cheap machine. You don't want to be making a situation in your health worse by exposing yourself to some of these things. I didn't show you, just real quickly, this is my old ozone air purifier generator that I've had to clear my house of different ozone things. But there again, this uses metal plates, and I would never use a device like this for any type of internal medicinal use.
Okay, we're going to take a few minutes and answer a few questions. We do have one here in the chat. How is the ozone sauna treatment done?
Okay, I'll probably take it back in there and show the sauna in a little bit more detail. Okay. So my sauna, it does have its own internal, so this is the sauna. Now, again, I'll turn it to this side perhaps. Again, I'll emphasize that the ozone, you can't breathe the ozone. So that's why your head is outside, and you're ozonating your body. Now, my ozone generator this sauna does have its own ozone generator. You can see the temperature controls on the sides, and then the ozone dials that are down below. So the ozone is generated there. Now inside here, this is a steam sauna. So you have the water down there. So the boiling, the element, the heating element is in there. The water is boiled, and then it comes up through different holes within the sauna. And then the ozone itself is piped in through a hole that's in the corner. You can't see it very well. You have a seat that sits on the little grooves there. And basically the person just sits inside there. You close the door, the head is out the top. I wrap the neck with towels. and they just sit in there at a comfortable temperature. Now, ozone will degenerate with heat. And so I advise people that actually the purpose of this particular sauna is not to get hot and not to be sweating enormously, profusely. It's just to be warm enough to open the pores and to allow the ozone to penetrate through the pores into the body.
Okay. Okay. Now, is there for that's obviously an expensive device there. Is there a less expensive way that you could do the the ozone sauna? Do they have
Sure.
devices that are, more portable, less expensive?
So what I would do in that case is, and I've recommended this to many people, is you can go on to, again, Amazon probably is maybe the best way to find something like this. They have they're steam saunas. It's a tent, and basically you can zip yourself inside of it. Your head sticks out the top. There's a little steam generator that gets piped in there. So you're creating the same atmosphere. And then what I would do at that point is get your ozone generator, get the silicone tubing, and just put it in through a zipper someplace. And then you're getting the same effect. I
Perfect.
think that, I mean, over here, one of these steam tents is like probably $100. You could
Okay.
effectively find that.
Okay. All right. Here's a question. Should I use both the ozone generator and the O2 concentrator concurrently, or can I use the generator only? That's it's the I'll let you answer that. Go ahead. I think
I'm
there's a
not
little bit of
sure.
misunderstanding here. You have to have the ozone generator has to have oxygen input in order to generate the ozone. So yes, you have to
Yes.
use them both together. You have to have an oxygen
Yes.
source separate from your generator.
Yes, sorry, I might not have explained that very well because I showed an oxygen concentrator, which is an oxygen source. Basically, that takes the ambient air and
Hmm.
it concentrates the oxygen. It also runs it through some filters. Now, my particular concentrator will give you 92 point something percent pure concentrated oxygen. Whereas my tank that I get, that gives you 98.8% pure concentrated oxygen. So there's a little bit of difference there. I feel comfortable. This is a question that I get often is okay, so 92% compared to 98%, there's not that much difference. To be perfectly honest with you, ozone kills viruses, it kills bacteria, and it kills funguses. I feel safe for myself using an oxygen concentrator at 92% purity to do most things. I probably wouldn't use it for intravenous things, but I would use it for the sauna, insufflations, all of those things, because actually any impurities that are in there are going to be taken care of by the ozone. But those are the two oxygen sources that you can use to feed into the generator to produce your ozone.
Okay. And obviously this is not by any means a comprehensive class. This is just an
Sure.
introductory interview to let people know what ozone therapy is and how it can be utilized. And so there's a lot more to it. You just have to do some research and educate yourself. So if there's no other questions, we'll take just a minute. If anybody has a question, you can either raise your hand or type it in the chat. We'll take just a minute if there's any questions. Michelle, I really appreciate you taking the time to come today, and happy birthday.
Thank you very much.
Tomorrow is Michelle's birthday. So I won't ask you to tell us how old you are.
Very good. Thank you very much.
You are welcome. Okay, let's see. We answered the question there about the ozone constant generator and the concentrator. You have to have an oxygen source
Yes.
for the ozone generator to function. Okay. All right. If there's no questions, I think we went ahead and answered them as we went along, so that's good. I'll go ahead and
If
end the meeting
if
there.
I Just if you want more information, I do have a website. You're more than
Okay,
welcome
perfect.
to visit the website. It's ozonetherapies.co.uk. So it's not .com. That's ozonetherapies.co.uk. There's a bit more information on there.
So, and I'll put it as a banner on, I am going to put this on our YouTube channel, hopefully
Okay.
later today if I have time to get it edited today. So, thank you everyone for joining us. Thank you, Michelle. I appreciate
Thank
it.
you.
And hopefully we can maybe do a follow-up on this at some point.
Yes, of course. Anytime. Happy to
Okay.
help.
All right. See you, everybody.